Let me get a few things straight. Okay. It's 12:05 with me. Let's start with the next topic. The next topic is triangles of the neck. Triangles of the neck. Here in this particular section, I will be discussing how each of the triangle is formed. The other way of saying is what are the boundaries of each of the triangles. Then we will discuss what are the components present inside them. I will not be going into the very detail of each of the components, but let's focus about the triangles. First of all, the whole of the neck. On the back, the neck is covered with the trapezius muscle. It's a very broad muscle we discussed in the last lecture. So, in front of it, the neck, all the neck that is in front of the trapezius, it is divided. This part, it is divided into two triangles by this muscle. This is called sternocleidomastoid muscle, the muscle that runs from mastoid process all the way to this process. So this is called let me get a few things straight. Yes, so this is the whole of the sternocleidomastoid. The part that is anterior to it will be the anterior triangle. The part that is posterior to it, it is called the posterior triangle. I would encourage you to do is through the pictures, it would remain longer with you, it will last longer, and you won't have to memorize the other things. So let's see how the anterior triangle is being formed. It is labeled in the green right here. So the anterior triangle on the upper aspect, it is by the jaw. The lower margin of the mandible, it is forming the upper boundary of the triangle. Posteriorly, by sternocleidomastoid. Which border of sternocleidomastoid? Anterior border of sternocleidomastoid. And superiorly, posteriorly, superiorly mandible, posteriorly sternocleidomastoid. Then we are left anteriorly. There is no very prominent anatomical structure that defines it. Simply the midline, the sagittal plane, the midline that you can draw on the skin, that will be the anterior limb. So this is the anterior triangle. Superiorly there is mandible, posteriorly there is sternocleidomastoid, medially or anteriorly, because the neck is curved for the part, the most medial part is the most anterior part also, that is the midline. Posterior triangle, the part that is under the cover of sternocleidomastoid, is not considered a part of either of the triangles. You will see in written in the books that cervical plexus, it's not a part of the triangles because it is under the cover of sternocleidomastoid. Let's move to the back. This whole area, this whole area, this is the posterior triangle. Anteriorly covered by the posterior margin of the sternocleidomastoid, posteriorly by the trapezius, and inferiorly by the clavicle, middle one third, the part which had the supraclavicular space. Okay. So anteriorly there is posterior boundary of sternocleidomastoid, posteriorly there is anterior boundary of trapezius, inferiorly there is middle one third of the clavicle, and on the top there is the apex. It is no boundary, it is by the skull, base of the skull. It is the anterior triangle is further divided into four parts. The posterior triangle, it's divided into two parts. Let's leave it like that. Let's start with the anterior triangle. This is a picture from later, looking like this. Remove the skin. So anterior triangle, anterior triangle is bounded by midline, anteriorly or medially, jaw, lower margin of mandible, superiorly. Some books say supralaterally because it's up and lateral. Posteriorly, and some books says laterally because when we're going posteriorly, you're also going laterally. It is said lateral, it is said posterior, it is said posterolateral, and even infralateral word is also used because it's inferiorly and laterally. So this border, the lateral border, it's made up of anterior margin of sternocleidomastoid. Let us see how it is divided into four further joints, four further triangles. Before going into that, identify the muscles that you did last day. This muscle, is digastric. This is the anterior belly. This is the posterior belly. Behind it, this point, this is the mylohyoid muscle. This horizontally running bone is the hyoid bone. This muscle that goes from the hyoid bone to the sternum, that is sternohyoid. This muscle that goes here, moves through the sling and goes here. This is called omohyoid. The part that is present here is the superior belly. The part that is present here is the inferior belly. And of course, we are left with sternocleidomastoid. So let's see how they take part. These are the muscles, especially keep in mind that digastric, anterior and posterior bellies, omohyoid, superior and inferior belly. These will be the major muscles playing the part. So this is the first triangle, submental triangle. You can see how it is being formed. Laterally by the anterior belly of digastric muscle, posteriorly by the hyoid bone, body of the hyoid bone, and medially simply the midline. So this is submental triangle. This is submandibular triangle because it is present below the mandible. It is present below the mandibular fossa, below the submandibular gland. It is called you see submandibular gland is present right here. It is having three boundaries. The medial one will be the anterior belly of digastric. Posterolateral one will be the posterior belly of digastric. The anterolateral one will be the inferior margin of the mandible. So these are the three triangles. This is called submandibular triangle. The alternate name is digastric triangle because almost whole of it is being covered by the two sides are covered by the digastric muscle. The alternate name is submandibular. Alternate name is submandibular triangle. Then the next one, this is carotid triangle. As you can see, it is having carotid vessels in it, internal carotid and common carotid. So it is made up of superiorly. You can see that thus there is digastric and styloid muscles, and anteriorly there is omohyoid, superior belly of omohyoid, and posterolaterally there is anterior margin of sternocleidomastoid. Muscular triangle. It has two lateral borders, supralateral, infralateral, and one medial border. Supralateral border is formed by the superior belly of omohyoid. Infralateral is made up of sternocleidomastoid, and medial one is made up of midline. So these are the three borders of the four triangles that are being made by the anterior triangle. There are two key muscles that are doing all of this work, that is digastric, two bellies, and superior belly of omohyoid. And of course, there is midline here. So these are the contents. Before moving into the contents, let me show you this picture. If you're reading Snell, you will see this picture. Submental triangle between the midline, hyoid bone, and the anterior belly of digastric. Submandibular triangle, digastric triangle between the margin of the jaw, anterior belly, and posterior belly of digastric. Carotid triangle present between the posterior belly of digastric, superior belly of omohyoid, and the sternocleidomastoid. And we are left with muscular triangle. It is present between the superior belly of omohyoid, sternocleidomastoid, and the midline. Of course, the upper peak is being made by the hyoid bone also. So these are the structures that are forming the four triangles of the neck. But right now, I will just say to memorize the things, but I can try a little to the submental triangle. Submental triangle, this area, it contains the lymph nodes of the same name. Submental lymph nodes. It will contain submental lymph nodes, and it will contain submental lymph nodes, and there will be some internal jugular veins that are present here. Submandibular triangle, digastric triangle. This is okay. Here is the submandibular triangle. Below it, there is a submandibular space that I skipped earlier. I will go to it just after this. It contains, as we see by the name, the submandibular gland, and the lymph nodes present here have the same names. And the facial artery, the facial nerves move through this. Then you can see in the base, in the floor, there is mylohyoid muscle. So the nerve to mylohyoid, the mylohyoid vessels that are supplying this, they move through here. And for a little part, the hypoglossal nerve comes in this aspect also. We will discuss this, we will discuss the tongue. Then there is a carotid triangle. Immediately, if you don't think of anything, just think of uh, the contents of the carotid sheath, the carotid sheath itself and its contents. Common carotid artery, internal carotid artery, external carotid artery, all of its branches, all of the branches. There are 8 branches of external carotid artery. One branch is excluded here. Just remember this name. All of the branches of external carotid artery except posterior auricular. Then there is lingual, facial, all the other arteries, the lingual facial veins. You will memorize these vessels inshallah tomorrow when we discuss the branches, the arterial tree and the venous branches, venous tributaries. And then there is hypoglossal nerve, the part of the ansa cervicalis and the lymph nodes. Muscular triangle, just remember the digestive tract, the respiratory tract and the viscera in front of it. So the digestive tract will include larynx above, trachea below. The digestive tract will include pharynx above, esophagus below. You must have remembered from the uh, you must remember from the thorax that between the two, the trachea and esophagus, there is always running of the recurrent laryngeal nerve. This will be the part of it. And in front of this, there is an organ that is present, that is the thyroid gland. Thyroid gland and just behind it parathyroid gland. So these are the structures that are formed in the middle, so the muscular triangle. So we are trying in the muscular triangle. Then there is a posterior triangle. Posterior triangle have two important questions. First, the boundaries. Overall, the posterior triangle has anteriorly sternocleidomastoid, posteriorly it has trapezius, and inferiorly clavicle. If you want to fill more pages, go into more detail. Anteriorly, it has the posterior border of sternocleidomastoid. Posteriorly, it has anterior border of trapezius. Inferiorly, has middle part of the clavicle. These are the boundaries. Then the question arises about the floor of the um, posterior triangle. This is a very important question, commonly asked, especially in the vivals. Which structures are forming the floor? Just stick to the labeling. The first muscle, the most commonly, splenius capitis, then levator scapulae, then scalenus medius. These are the muscles that you must remember. They are very visible here. The one whose only margins are seen, these include semispinalis on the top, and on the bottom end you may see scalenus anterior. You see how difficult it is to see them. And you may see first slip of serratus anterior. You may see the first slip of serratus anterior. So these are all of the muscles that are forming the floor of the posterior triangle. If I go from all of them, semispinalis, splenius capitis, levator scapulae, scalenus medius, scalenus anterior, and if you are extending the neck and you are doing too much of the effort, you may see the serratus anterior. Now, let's talk about the breakage of the triangle into two contents. The posterior triangle, just like the anterior triangle, was broken up into 4 triangles. The posterior triangle is broken up into 2 triangles, the upper one and the lower one. And the thing that divides them, it's this. This is the inferior belly of omohyoid. Inferior belly of omohyoid. So the triangle that is above it, that is the occipital triangle. I have highlighted for you. And the one that is below it, it's the supraclavicular triangle. And even if I don't tell you, you can pick up by the image the boundaries of them. The occipital triangle will have sternocleidomastoid, trapezius, and inferior belly of omohyoid, and the supraclavicular triangle will have sternocleidomastoid, inferior belly of omohyoid, and middle third of the clavicle. So these are the posterior triangle. Contents are numerous, and I won't be helping you very much in memorizing it. But let me tell you how do I remember it. I go system wise. Let's go to the arteries first. Arteries include subclavian artery. Subclavian artery, it contains the last part of the subclavian artery and second and third part. Basically, it contains the third part of the subclavian artery, and it will have a few of its branches, that is supraclavicular, dorsoscapular, if said. Then there is subclavian vein. Of course, if there is artery, there will be vein. And there is external jugular vein. External jugular vein moves like this, and it goes to the back and it dips right here. And here it goes inside the deep fascia and it merges with the internal jugular vein. So external jugular vein is here. Then there are saw the um, cutaneous nerves. So these are also here. You saw the cutaneous nerves emerging from right here. The one that was going front of it, the transverse cervical, the one that were going below, the supraclavicular, the one that is going up, the greater auricular, and the one that is going to the back, lesser occipital. So all of these will be the branches, will be the components of this posterior occipital triangle. Then another important nerve that is supplying the two major muscles here. You are supplying the, you see the sternocleidomastoid in front and trapezius at the back. Then there is a nerve that move like this. From it is inside sternocleidomastoid. It emerges from the sternocleidomastoid, goes to the back and inserts into the trapezius. So that will be accessory nerve. So, and of course, if we're talking whole of the posterior triangle, inferior belly of omohyoid will be one of its contents. Posterior, the deep cervical lymph nodes, the posterior aspect, there will be some nodes on this aspects also. And so these are the things that will be present here. So let's see if we have skipped someone. There will be occipital artery, branch of external carotid that will goes back, the transverse cervical, suprascapular, and subclavian arteries. Occipital is a branch of external carotid artery, not a branch of subclavian, but these are branches of subclavian. Transverse cervical, suprascapular, external jugular veins, accessory nerves, cervical plexus branches, brachial plexus trunk. Brachial plexus is seen a little here between scalenus medius and scalenus anterior. Here is the boundary of scalenus anterior, here is the scalenus medius. So you will see brachial plexus exiting from here and going behind into the axillary region. So this is about that posterior triangle. Before moving into the cervical plexus, let me fulfill the promise that I made before about the submandibular space. So I skipped it before, submandibular space. So simply speaking, it is the space that is enclosed by the submandibular triangle, that is enclosed by the submandibular digastric triangle. So space is it was two-dimensional, triangle is two-dimensional. So you need third dimension. So below it will be covered with investing layer of deep cervical fascia. Above it will be by the mylohyoid muscle, floor of the mouth. So this is all the extents. So superiorly above it will have the mylohyoid. You see, so this is the submandibular space right here. This one, the little one right here. Here will be the submandibular space. Above, the upper and lower margins will include, above it will be the mylohyoid muscle. Below it will be the investing layer of deep cervical fascia. So this is the submandibular area. So it is shown right here. Below is the investing layer, above is the mylohyoid. So this is the submandibular area. Superiorly, mylohyoid, inferiorly. If you go all the way to the skin, you will go through investing layer, superficial fascia, and the superficial fascia, including the platysma, and you will go to the skin. And then the three borders will be the three borders of the triangle. Anterolateral will be the mandible. Anteromedial will be the anterior belly of the digastric. Posteriorly, there will be the posterior belly of the digastric and hyoid bone. So there will be plus posterior belly. So this is the space. So if you move at the neck, you can touch it right here. This is the submandibular space. Okay. It contains, what are the contents that it contains? I will be, I don't have the picture right now. Let me get the picture. Mm, Give me just a second. Just give me, okay. Let me change the view a little. I have too many balls in the air. Okay, let's see like this. Yes, this is a picture from Gray's Anatomy, Gray's Atlas. So here you can see, okay, here you can see the posterior, here you can see the mylohyoid muscle and the posterior margin of mylohyoid muscle. This is the mylohyoid muscle. And if we move to the picture below, you can see the submandibular gland. We will go into the glands a little more detail as we go into the oral cavity. So this submandibular gland, it winds around the mylohyoid muscle and come to the top of it. See, here is the mylohyoid muscle. Submandibular gland is below it. It moves around and on top of it to the sublingual space. So the point I'm trying to make is the submandibular space that is below the mylohyoid muscle. It curves around the posterior margin and comes to the top of the sublingual space. So the submandibular and sublingual space are in connection with one another behind the posterior border of mylohyoid. Submandibular space contains the submandibular gland itself, the lymphatics and nodes by the same name. There is facial artery, facial nerve, part of lingual artery, hypoglossal muscle under a little bit passes through it, and that's it. So that's about the different infections. I'm not going into the much detail of the sublingual space. It is present above the mylohyoid muscle and below the mucosa of the tongue. Just keep this particular point in mind, and then we will discuss it when we will discuss the oral cavity. So the infection of the submandibular space is known as Ludwig's angina. It is known as Ludwig's angina, and Ludwig's angina, it may go behind and above into the sublingual space. And usually, why does it occur? Let me get to again the atlas again. Okay, um, to the atlas again. Yes. If we look at the atlas, you may see that the mylohyoid line is oblique. So the line of attachment of the mylohyoid muscle, posteriorly it is higher, anteriorly it is lower. So the roots of the teeth, the root of the molar of the posterior ones are related to the submandibular space, and the anterior ones are related to sublingual space. The posterior roots go beyond, the anterior roots stay above. So the extraction of these teeth, if there is an infection of the roots and this infection, it goes through the bone into the spaces, they may come into the sublingual space and submandibular space. For the teeth that are in the back, that is the molar teeth, they may lead to the infection of the submandibular space, that is Ludwig's angina. So the injury of the oral mucosa, it will give infection to the sublingual space, some prick that happened, and it goes to that. Below the mylohyoid line to the submandibular space, above the mylohyoid line, anterior bones, premolars, it will sublingual space. So that's all about the triangles and the spaces and fascia. I'm taking just little break. What's the time with me? I have 12:30. Let me give a 2 minute break. After that, we will continue with the nerves. Two nerves, set of nerves, we will be discussing cervical plexus and the cerebellum and the sympathetic chain. So let's take a 2 minute break. Okay, let's move.